Good morning and welcome to the webinar. My name is Steve Johnson. I'm a professor of healthcare policy and research at Weill Cornell. I'm also the director of graduate training for the department. I'm joined here today by my colleagues, Dr. Aryan Jung, Jessica Anker, and Mark Unruh.
Hi, my name is Aryan Jung. I'm an assistant professor of health policy and research at Weill Cornell and director of the Masters of Science in Health Policy and Economics.
And I'm Jessica Anker. I'm an associate professor of healthcare policy and research, and I'm the director of the certificate program in health analytics.
And I'm Mark Unruh, assistant professor of healthcare policy and research.
Thank you all for being here, and thank you to all of you watching for joining us today.
If you have any questions during the presentation, please feel free to type them directly into the chat window on the screen, and we'll see them. We'll answer them toward the end of the presentation. And we're also recording today's webinar, and we'll be posting it online later today. So if you've missed anything, feel free to come back to our site later to watch anything you might have missed.
Terrific. Okay. We're excited to be joined by our students and alumni today. Alumni, why don't you quickly give your names? And we also have students joining us today, and if you could also give your names.
Hi, my name is Faria Hafiz, and I'm an alumna of the Masters in Health Informatics program.
Hello, my name is Derek Lake, and I'm a candidate for the Masters in Healthcare Policy and Economics.
Hi, everyone. Andrew Huang, also a candidate for the Master's of Science in Health Policy and Economics.
And I'm Lisette Roman. I'm a candidate in the Health Informatics program.
Okay, thanks everyone. In today's webinar, we'll discuss our three programs: the Master of Science in Health Informatics, the Master of Science in Health Policy and Economics, and the Certificate in Health Analytics. This webinar will be useful for all of you, regardless of which program you may be interested in, as our programs have some shared courses that will certainly interest all of you. So Steve, perhaps it'd be useful for people to know a little bit about the history of our programs.
Definitely, Mark. Let me give you a little bit of background on our programs and also our institution. In 1898, Cornell University established Cornell Medical College. As many of you know, the main campus for Cornell is in Ithaca, New York. But the medical college was founded in New York City basically because of the many clinical training opportunities that were available. Today, the college is affiliated with multiple New York City-based medical institutions. These include New York Presbyterian Hospital, Memorial Sloan Kettering Cancer Center, the Hospital for Special Surgery, Rockefeller University, and many more. In 1952, Cornell founded its Graduate School of Medical Sciences, and they began to offer PhD and other graduate degrees. In 1998, the institution was named Weill Cornell Medical College, and recently we officially became Weill Cornell Medicine to better represent the breadth and depth of everything we do best: world-class patient care, cutting-edge research, and of course, top-ranked education. Our department concentrates on studying and improving healthcare delivery, and we seek to optimize the value of healthcare for patients across the country. Our department chair is Dr. Renu Kaushal. She's an expert on healthcare quality, patient safety, and information technology.
So let's talk about our three programs in more detail. These are some of the strongest graduate programs in our field. We've got a very diverse set of students and applications. Some people are recently out of their undergraduate degrees. Others are changing careers after being in the field for 20 years or more. As you can see on the slide, both of the master's programs can be completed in 1 year if you're a full-time student, or up to 2 years if you're a part-time student. In addition, both master's students require a research project and thesis, which we'll discuss in more detail a little bit later on. We also have a unique academic year. We've got 3 terms over the course of 12 months. So we've got a fall term, a spring term, and a summer term. The certificate program in health analytics also takes 1 year to complete, but it's part-time. You take only 1 course per term and complete it within the same time frame. So let's go ahead and talk a little bit more about the Masters in Health Informatics.
Sure, thanks, Jessica. Health informatics is a field that studies how people use information and information technology in healthcare. Our program in informatics focuses on the use of information technology to organize, coordinate, manage, and deliver high-quality care. Our goal is to train students for careers in healthcare delivery, health insurance, technology development, consulting, and academics. Here's an overview of the courses in our health informatics curriculum. Our informatics-specific courses are shown here in red. They provide training in information systems, information exchange, and healthcare quality. Additionally, our Masters in Health Informatics explores special methods to study these systems and computational techniques to analyze the data. Both of our master's programs build on a shared set of courses. These are shown in orange. These relate to healthcare policy and research. These courses provide training on how the healthcare delivery system functions, how to ask questions about these systems to improve them, how to use statistics to answer and improve on challenges created by healthcare, and finally, how to work with the richness of healthcare data.
We've got some health informatics students and an alumna with us today, so let's take a moment to talk to you guys about your experiences in the program. So, Lisa, your current program, we'd be interested in hearing what made you pick Weill Cornell when you were looking for a program.
Sure. So I started my search when I was still living in Boston, and I knew that I wanted a Master of Science, so that helped to narrow my choices a little bit. But I was really looking for a program that had close links to academic medical centers, and that was one way that Weill Cornell, made its way to my top three almost immediately. And I was also really impressed by the rigor of the curriculum, the fact that we're supported to produce a thesis at the end of just 1 year is quite impressive, and that was important to me for my degree. And then specifically for Weill Cornell, I had actually come across some of the papers, some of the health IT evaluation work led by Dr. Kashal, and so when it came down to decision making, I already had an idea of who was kind of leading the field.
Great. Now that you're here, are there any courses or aspects of your training that you're really enjoying?
Yeah, there are definitely several. I think first is probably starting in the class, not just professors, but my classmates. I think we already alluded to the diversity of students, but it's just great in the middle of a class discussion to have a physician chime in or someone from IT chime in and offer a new perspective. It really changes the course of the discussion. And also, as I mentioned, being an academic medical center, we're able to have guest lecturers come in and share their experiences, not just from New York Presbyterian, the immediate affiliation, but also Memorial Sloan Cancer Center and some other hospitals right in the region.
Yeah. And you had a little bit of an unusual background coming in. You didn't come in from computer science or engineering. What was your background?
Sure. Yeah, unusual, I guess, is a good term. So my undergraduate training was in psychology. I immediately spent a year in clinical research in a neuroimaging lab, but I was drawn to clinical information systems during my year in that lab, and so I spent the past 3 years working in quality improvement on the operational side of things at Mass General. So I was dedicated to the Department of Psychiatry, and I worked on a number of projects to implement clinician-facing information systems, and that's what made me realize I wanted to stay in this field.
Great. You just finished your first semester a couple days ago. What was your favorite class so far?
So I have to say the health information systems course, talked by Dr. Arts. So the reason why I enjoyed it so much is because we had a guest lecture almost every class. So it was pretty nice to have people come in from industry, not just from the hospitals around us, but I mean, one class we even had led by a lawyer who works in health IT contracts. And so this class was different from some of our more academia-centered courses, in that we had really tangible industry experience, people coming in, so we can see kind of where we might end up after the program.
Great. When you were talking about your background, that reminded me of Baria's also unusual background. So Baria Hafiz completed the Master's in Health Informatics in 2014. Tell us about your background as you were coming into the program.
Sure. So I completed my undergraduate studies at Rutgers University in 2012, and I majored in neuroscience and journalism. I took some time off after and worked as an emergency department scribe. So what that meant was that I helped physicians in the emergency department chart for the patients in their electronic health record. So that was my first introduction to the health IT field, which led me to find this program, and here I am now.
After you finished the program, where did you go to work?
I work here. So I'm a research coordinator actually in the Department of Healthcare Policy and Research. My work sort of spans across all spectrum. I mean, we do quantitative work where we do data analysis, and I also help out in qualitative work with Jessica, looking at how patients and people interact with health information technology.
Great. When you look back at your coursework and your experience as a student, what did you enjoy?
So I'm going to follow up with what Lizette said. So my favorite part of the program was actually the master's thesis. So as an undergraduate, I worked for 3 out of my 4 years. I worked in a lab. So research is always something that I knew I wanted to pursue. So knowing that this program had such a focus on the master's thesis was something that really drew me to this. And it was great working one-on-one with a mentor for the entire year, sort of starting a project and then actually having results and presenting it towards the end.
And you actually got a couple of publications and presentations out of your master's work as well.
Yes, so my thesis was just published recently, a few months ago. And I presented my original work, my master's was actually at the American Medical Informatics Association in 2014, and then work that I've done in the department since I presented this year, again at AMIA.
Great. Thanks so much.
Thanks. All right, great. Thanks, Lizette and Maria. So Aria, now that we've discussed the MS in Health Informatics, let's talk about our second master's in Health Policy and Economics.
Sure. So our Masters of Science in Health Policy and Economics trains the next generation of leading healthcare researchers and analysts. And students learn to apply cutting-edge research methods to conduct rigorous analysis of healthcare data through hands-on experience under the mentorship of faculty members. Alumni explore careers as policy analysts and researchers who examine ways to organize, manage finance, and deliver healthcare. So here's an overview of a health policy and economics curriculum.
Okay, so as you might expect, our health policy and economics specific courses, now shown in red on the screen, provide a strong foundation in health policy and economics. Students will become well-versed in the financing of healthcare, economic components of the delivery system, and the role of government. Students will also learn to apply advanced research methods to evaluate policies and programs while gaining hands-on experience in data analysis. As Keith mentioned earlier, the shared courses remain the same across both programs to best train our students how the healthcare delivery system functions.
That's right, Mark.
Just like with health informatics, we also have some health policy and economics students with us right now. I'm sure you'd love to hear more from them. So let's start with Derek Lake. Would you mind telling us a little bit maybe about your background and why you chose Weill Cornell?
Sure. So I came to Weill Cornell after completing my undergraduate degrees in accounting and finance in the spring of 2015. During undergraduate, I had done a lot of research with the economics department, and in my last 2 years, I worked on research in healthcare economics. And I decided this was something I was interested in, and I wanted to use this master's program as sort of a transitionary step, and also to test myself to see if I had what it takes to work in healthcare economics research.
Okay, great. Is there a particular class that you've enjoyed?
Sure. So it's actually tough for me to pick one of the courses that we've taken because I feel that there's a lot of synergy between the courses we're taking. The sum seems to be weaker than the product of its parts. And so Dr. Kern's course in healthcare services research seems to be the backbone for the program, where we learn from end to end how to formulate a research question, a hypothesis, in order to understand the problems in this field. We take health policy and economics, introduction to health policy and economics with Dr. Arian Jung, where we get to learn about the actual policy interventions that have been applied. And then in Dr. Banerjee's course, we learn how to actually analyze data sets through statistical analyses. So this all fits into the conceptual framework of the health services research course. And I think that together, taking all three of these courses has been tremendous so far.
Great. That's great to hear. So is there one thing you've learned this year that's really surprised you?
Sure. So what surprised me is the level of faculty engagement across the entire department. I knew coming into this program that we'd be working individually with research mentors as well as the professors and assistant professors to our courses. But throughout the semester, as mentioned by Lisette earlier, we got to hear from many of the people in the department, and it was really a multidisciplinary approach and a holistic effort to engage the students as much as possible in whatever we might be interested in. So I think that the program's done a really nice job in exposing us to not just the entire department, but as well as the other employees of the hospital who might have some interesting things to say.
Great. Thanks a lot, Derek. So we also have Andrew Wong with us. So Andrew, could you tell us maybe how you think your studies might prepare you for your future career goals?
Hi, sure. So a little bit about my background. I currently work at the New York State Department of Health, and while sort of a disclaimer, I'm not here to promote, or I'm not here as a representative of them, one of the great things about working for a government agency, especially the Department of Health, is that you have access to a wide wealth and a wide range of data. But the problem with that is there's always a need for people to interpret that data. How do you take data? How do you analyze it? How do you report it? And how do you use that to inform policy-making decisions? How do you advocate for policy? So it's sort of as a sort of personal note, one of the things I've noticed when I've been working at the department is that we're always looking for people who have a skill set sort of for that sort of position. Sort of being able to use statistical software, being able to take large data sets, interpret them, and report on it. So I mean, that's really one of the things I really get from this program is that very pragmatic technical knowledge as well as the expertise from the mentorship and the faculty about how do you apply that information, that skill set to the work that you're currently doing, the project that you're currently doing.
Great. And can you tell us one thing that you've learned this year that surprised you?
Well, one thing I've really learned is that this program is very flexible. So sort of working a 9-to-5 job, it's definitely possible to complete this program within a year. The classes are very accommodating, the faculty is very accommodating, and really it's a matter of how much time commitment you put into the program that will sort of say how much you'll get out of it. So that's one thing I've really learned this year that is very great to sort of talk about.
Okay, thanks. And what was your background coming into the program?
So sort of as I said earlier, I currently work in the Department of Health, but I graduated from actually as an undergrad at Cornell University a year ago. I sort of was interested in public health and sort of, again, having worked at the health department, interested in sort of health policy making. So while I was looking for grad school opportunities, I was sort of weighing, this Master's of Science program with a lot of other programs with Master's of Public Health, as well as sort of medical school programs as well. Sort of what would be the degree that would help me sort of get the skills that I needed to do the project that I wanted to do. And ultimately, I decided on this Master's of Science again because, as I said earlier, it's very, very focused on the technical knowledge and the expertise for analyzing data sets, which I think is very necessary, and I think is quite honestly the future of sort of the industry, the healthcare system, where there's going to be a need for people that are able to do that. So,
all right, wonderful. Thanks, Derek and Andrew.
Thank you all for describing your experiences. So a couple of you talked about the research project and thesis. This is a unique aspect of both of our master's programs. The idea of this project is to engage students in a hands-on project that culminates in a thesis. What we do is we pair each of you with a faculty mentor who provides training, access to healthcare data sets, and interaction with faculty and staff who are conducting research studies. Through field work, you get a rich experience in healthcare delivery at Weill Cornell Medicine, New York Presbyterian Hospital, and some of our other partner institutions that I mentioned earlier. In addition to our two incredible master's programs, we also offer an exciting certificate program in health analytics. Jessica, why don't you talk a little bit about that?
Thanks a lot. Yeah, I actually think that Andrew Huang's comments earlier were a great segue into this. The idea of the certificate in health analytics is to give people an opportunity to learn that kind of hands-on data analysis that is becoming more important as the healthcare system generates ever more data, ever larger sets of data. But the unique aspect of the certificate is that we created it with the idea that the working professional would be able to do that part-time rather than perhaps investing the time and effort that it takes to do the full master's program. So the certificate in health analytics begins with the introduction to biostatistics. That's definitely a very tough course, but it'll be the only course that you take during that semester. It segues into health data for research, which is the practical applications of your statistical training. And then health data mining is the summer course, and that's more computational methods and machine learning type of approaches to do other visualizations and other sorts of learning from big data sets. The goal is that you come out of that with the basic tools that you need to do big data analytics in healthcare.
Thank you, Jessica. Great.
So the application is live until February 1st, so you're able to apply at any time. Simply go to hpr.weill.cornell.edu/apply. We require 3 letters of recommendation, which can be submitted any time during the application process. Once they're finished, your recommenders can send them directly to us by emailing hpr-education@med.cornell.edu. However, we'll put that email address up at the end of the presentation as well. We require the latest official transcripts from your undergraduate institutions, as well as from any graduate degree you may have completed. You'll also need to write a personal statement that describes your interest in healthcare and this program. We recommend that you begin working on the personal statement as soon as possible in order to have ample time to revise and edit it. Along with those requirements, simply submit the online application and the $60 application fee. We also ask that you follow up with your recommenders to make sure they've submitted your letters of recommendation. You should also follow up with your institutions to make sure your official transcripts have been submitted. You can, of course, reach out to us at any time to check on the status of your application.
Thank you, Mark. 2 final notes about admissions. We do not require standardized test scores for admissions into our programs. However, we do strongly suggest that you submit your scores if you have them. These can really help strengthen your application. Typically, our applicants submit standardized test scores from the GRE, MCAT, or GMAT. If you're an international applicant, we will need recent TOEFL scores.
All right, let's take a moment to take a look at our website if you haven't already done so. So let's click here and visit our education page. There's a bunch of information that we invite you to check out, including more information about our programs, faculty, upcoming events, and our application process. As we mentioned before, our application is live, and we are available here to answer any questions.
Okay, thank you, Ariane. Now let's go over a few questions that some of you submitted during our presentation. For the rest of you, if you have any questions, go ahead and type them into the window now, and you can direct your questions to our faculty as well as to the students and alumni who spoke earlier. So please start submitting your questions.
So Steve, we've got a couple of questions here. Can you read them?
Yes, absolutely. Hi everyone, my name is Vanessa Yassa. I'm the education coordinator in the department, and I'll just read aloud some of the questions that are coming in. Someone would like to know whether any of the students get involved in active healthcare economics research while enrolled in the program.
Yes, so this is Mark Unruh. That's definitely the case. So as we mentioned, you'll need to do a capstone project, for example, a thesis, and often many of those topics involve active research in health economics. So I currently have 4 students, all of whom are working on projects that would involve research in health economics. So they're working with data, and I imagine that once they complete their theses, that they'll probably submit them as manuscripts to medical and health policy journals, possibly even a health economics journal. And additionally, there is room given, depends a little bit on the student about how much time you have, but there are also people working on additional projects aside from their thesis.
Great, thank you. I want to also mention that if anyone has specific questions for our alum or current students, feel free to ask as well. Another question that just came in, an international student or applicant has taken the IELTS exam instead of the TOEFL, and we will accept that score as well. So you don't need to take the TOEFL in addition to that. Another question, what does the part-time schedule consist of? I don't know if you want to maybe start with health informatics.
Yes, we have a pretty significant proportion of our students are half-time. We sit down with you in advance and work out a course schedule to make sure that you're taking the prerequisites first and then the later courses later, and it averages out to be about 2 courses per semester, depending on your desired workload. So that's something that we've done frequently for both health informatics and health policy and economics.
So someone would like to know if these courses are offered after work hours.
For the most part, that's true. Yes, most of our classes are offered at 5 o'clock or later. However, due to resource constraints, for example, availability of classrooms and so on, we do have some classes that are offered in the afternoon. But we do make an effort to offer as many as possible in the evening to accommodate students who might be working.
One course that we do offer in the afternoon is deliberately chosen at that time period. It's the Health Systems and Services course, because that's where we send students to do on-site observations of the actual clinical areas, the clinics and the emergency room and the pathology labs and things like that. So we require that during business hours so that you can actually see how a lot of that is going on. So for students who are working full-time, we give you plenty of warning that that's coming up in the spring semester, and for the most part, people have been able to flex their hours so that they can take 1 hour afternoon off a week and then make up those hours at some other date, time of the week.
Great. Another question, an international applicant would like to know if Weill Cornell has research projects based on international data.
That's a great question. Currently, we don't have any students working with international data at the moment. There are international data sets available, so if people are interested in that. We've also got a group right across the hall that's doing some pretty active work in Haiti. So we do have some connections. If it turns out that that's something that people are interested in, we can try to make those connections and set up that availability.
I think you will also have a global health department in our department.
Yeah, that's what I was. Yeah, they do other places as well. Haiti, yeah, that's sort of their main focus.
Yeah, so we could have worked to put you in touch with a faculty member who might have shared interests.
Yeah.
Vanessa, any more questions?
Here's one. So we have a couple students, it looks like, or applicants, excuse me, asking about job prospects. So sort of building on what we heard from our students and alumni in the room, After completion of your degree, students will have a wide variety of career opportunities. For example, as policy analysts in the healthcare industry, with various government organizations such as federal and state health departments, also research institutes. There are also opportunities in academia and quite a few in consulting firms. So as Andrew did a good job pointing out earlier, these employers increasingly need individuals with advanced skills in analytics, economics, policy evaluation, decision science, and implementation science. So, being able to work with large data sets and interpret the results of those analyses are a very useful skill that's in high demand. Also, students who want to pursue further studies after a master's program are well prepared for PhD programs from related areas, for example, in health services research or health policy. So again, the students will be paired with a faculty mentor who will not only help them with their thesis, but can also provide career advice while they're in the program.
And I'll just add quickly, in informatics, in addition to the big data analytics, which has been a focus of many of our students, we have also had students who've gone into more operational type jobs. One set of activities that people have gone into is implementation, and that's more of the working on the organizational change needed to roll out electronic health records and other technical innovations. And then another one is business analyst type positions. Those are people who are working in healthcare organizations in close connection with the information systems department, often doing, for example, analyses of pre-post workflows, pre-post needs and requirements within the departments that are undergoing the changes.
And also, if you look on our website, there is the bio of one of our former students who graduated and is now director of data and analytics for a healthcare startup in Boston. So you can read about her experience online.
All right, there's another question. What background do you require for this degree for HPE program? So we consider applicants from a variety of backgrounds, not just those who are policy economics major. Students typically enter from diverse backgrounds, experience, and interests, including medical professions, healthcare administration, public policy, population health, sociology, economics, and related areas.
Any more questions out there, please keep sending them in. And remember, you can ask questions of the faculty, but you could also ask any of our students and alumni about their perceptions and experiences here.
Okay, so here's a good question. It's one that commonly comes up. What's the difference between an MPH and your master's program? So I'll talk about from the perspective of the Health Policy and Economics program, and maybe Jessica can add a little bit about the Health Informatics degree afterwards. So there are some important differences. For example, most MPH programs tend to place greater emphasis on topics such as population health, epidemiology, and patterns of disease. MPH programs also tend to be more theoretically oriented, while our HPE program is more applied with a practice-based focus. So our program focuses more on a broader policy perspective to include payment policy, health insurance coverage, and also structural issues related to the healthcare delivery system. So again, you'll also work hands-on with data and get training and analytic methods to interpret what you see in the data. So our goal is to prepare our students to work effectively in organizations and also in the related policy environment as well-trained healthcare researchers with strong analytic skills. So Jessica, are there any differences with the health informatics program that would differentiate from an MPH?
Yes, thanks. I think you're right, Mark, that several of us in the program actually have MPH degrees. I have an MPH myself. The focus of an MPH is the broad spectrum of determinants of health, and as we know, that covers everything from environment to behavior to genes to medical care. Here in the department, we actually tend to focus on the delivery of medical care. In informatics, we're focusing specifically on this technological transformation that's changing the way healthcare is delivered, particularly in this country, but also internationally. So in that sense, it's more focused, as you say. I would say there's also a lot of breadth to that, because in order to work with and understand that technology, there's technology issues. There's also a need to become familiar with a lot of the medical and clinical issues, as well as the organizational issues of how doctors and nurses and allied healthcare professionals actually work together or don't work together, and how technology can disrupt or ideally facilitate that work. A tremendous focus on patient engagement, on reaching out to patients wherever they are. Most of the time they're not in the healthcare system, so where are they, and how can we connect them to doctors, how can we connect them to reliable sources of information, and then focus on usability issues, human factors issues. How do you develop technology that people want to use, can use without making mistakes, and that actually helps them think more efficiently and more effectively about health and medicine.
Another question, can a certificate student transition to the master's program?
Yeah, I'll take that one. And the answer is yes. All of the courses that the certificate students take count toward the master's. We do require that certificate graduates reapply. They need to apply and meet the requirements of the master's program. But should they be accepted, all of their previously taken credits would transfer and they wouldn't have to take those courses over again.
Okay, so someone's posted a question about collaboration with other institutions. So this is a great question. This is a really big advantage for our program. So being in New York is a huge asset. Local institutions, as we mentioned earlier, that collaborate with Weill Cornell include New York Presbyterian Hospital, which is right next door, as is Memorial Sloan Kettering Cancer Center. Likewise, the Hospital for Special Surgery, and Rockefeller University is just down the street. Additionally, we've also had a number of collaborations with the New York State Department of Health, the New York City Department of Health and Mental Hygiene, and many more. We have close ties to the other departments within the medical school, and also with the with the main campus up in Ithaca. The Cornell Tech campus is also under construction now, and we have close ties with the faculty there. They're currently holding their courses in the Google campus down in Chelsea, which is in Lower Manhattan, but will soon be in the campus on Roosevelt Island, just a short distance from our department.
I would also just add that we have a number of informal, in addition to the formal ties, we've got a lot of informal ties as well. So, for example, we were able to refer to Lizette for a job opportunity at SUNY Downstate, which actually is turning into her thesis because it's an informatics project. So there are a number of opportunities that wouldn't look like they would be available, but they are.
So there's another question, is this program too technical or require high quantitative skills or econ background? So the answer is no. The advanced quantitative skills or economic background is not needed. So our core courses, which you take in the first semester, will prepare you for quantitative courses in the second and then third semester. So for example, the core courses include introductory statistics and health economics. This will prepare students for more advanced courses in the program.
Yeah, you may have heard earlier from our discussions, the students have a wide range of backgrounds. Some are coming directly from their undergraduate degree programs. Others have been working in the field for quite some time. Others have been working for quite a while and are looking for a career change. And we also have a number of practicing physicians in the program.
The same could be said to be true for the health informatics program. Even if you don't have a strong quantitative or advanced quantitative background coming in, you'll take that same introduction to stats course in your first term. In your second term, you'll learn how to work with health data sets. Actually, it's a course that Mark teaches, and you'll get some hands-on experience of how to do analytic methods with those data. And then finally, in your last term, you will get a course in health data mining, which even if you don't have a computational background coming in, will give you a solid foundation in some basic computational techniques for working with data.
So I'll just quickly add that, as Aryan mentioned, we don't have prerequisites for advanced courses. But I think you can tell by the way that we're talking that what we are looking for is a desire to be trained in quantitative methods and a commitment to really put in the time that it's going to take to figure out how to get up through the learning curve and apply this in real world situations. So the coursework will be pretty intense, but the goal is that it trains people to become adept with the software and with the concept.
Yeah, it's a 12-month program with a thesis, so you start working hands-on with data right away, and things move quickly. But I also think that's an advantage.
Maybe we can take an opportunity, since we do have current students here and prospective students watching the webinar, if our current students might say like a 1 or 2 tips for those prospective students finishing or working on their application, what to consider, maybe a pointer on the personal essay or the process itself.
Sure, I can start. I would just say that one thing in preparing your essays and also your letter of recommendation is just don't be shy to ask for reviewers. So I wound up having not just my supervisor, but former professors from undergraduate, a family member who's in the medical field, and some poor friends review my essays, and that was really helpful. So definitely don't be shy, because the more reviewers that you can get, the more solid your papers will be.
Just another tip possibly would be something that I did that I think helped me a lot and helped me choose this program specifically. Is it might be worthwhile to investigate the faculty you'd be interested in working with for your master's thesis. Go ahead and take a look on their pages on the website, and you can get an idea of what subfield they're working in either health policy and economics or in health informatics, and decide which faculty you might like to work with. And maybe you could even include that in your essay on your application.
Great. So we're just quickly navigating to the website so you can see that we've got education programs, faculty listed, and then in addition to people who are specifically linked with the education program, there are other faculty throughout the department, but also throughout the medical school and the graduate school that that students have worked with.
Terrific. Any more questions from our audience?
No, and I'm thinking that maybe we should think about wrapping up.
All right, very good. Thank you, everyone. Those were terrific questions, and I really appreciate everyone participating and listening, and to all of our guests, especially our students and alumni, for being here with us today.
Well, Stephen, Mark, and I wish to thank you for taking a few minutes to learn more about our program. This is such an exciting time to be in the healthcare field, and I'm so happy to see such a strong, dedicated students in our program. I hope to see applicants from all of your this fall. Please feel free to reach out to us anytime if you have any questions.
I look forward to reading your applications.
Have a great day and a great holiday season coming up.
Thank you, everyone.
Thanks. Bye.